wrong.
Push the button.
My lecture is on psychopharmacology. Today, the mind is considered not brainless, and the brain is considered not to be mindless. So, it is clear that the mind and the brain are interrelated, because psychiatry is a branch or a specialty that extends from molecule to behavior. So not only is it just chemistry, but there is a tremendous amount of factors involved. There is socioeconomic opportunity, is development, is exposure to loss, exposure to injury, and so I will try and stop if you have any questions. Just raise your hand. I think these objectives are a bit overstated for an hour lecture, but major depression is now the most disabling illness, both in developing countries and developed countries. I remember when I came to the United States, blindness was the most common or the highest reason for disability in India. But now it is major depression. So I'm going to review the following class of medications: antidepressants, antipsychotics, mood stabilizers, and the new antidepressants. So everyone has heard about serotonin. It is the oldest neurotransmitter in the living organism. We still do not know where it came from, but a single organism that was the origin of life contains serotonin. Serotonin is a survival transmitter. It is the most ubiquitous transmitter in the human brain, and also the GI system and the urogenital system. It is also involved in formulation of long-term memory. So from essentially being a survival neurotransmitter, it has evolved into, first it was an autocratic system. And you know how that looks. The person on the top controls everything. That was the role of serotonin. Then it became quite democratic and even egalitarian. Now it has many functions. It extends from sex to cognitive functioning. So it is one of the most important transmitters when it comes to the human mind. So it makes sense that this would be the transmitter many of the pharmaceutical companies target for improvement. or improvement in its functioning. And there are many ways it can not function. And there are many medicines which correct some part of the functioning, but not another. So we are yet not very close to finding a medication for depression which is going to work 90% of the time. Of course, informed consent is the primary step. The more the patient knows about the hazards and benefits, the better alliance you have. And also a monitoring program, because you want to know after 6 to 8 weeks what the antidepressant has improved, what symptoms have changed. So in major depression, that's the first class of psychopharmacology drugs I'll review. What is major depression? There are 2 classifications, or you could say that if a person experiences no pleasure, doesn't look forward to anything that makes them happy, that itself is the criteria for major depression. That's the latest DSM-5 category, that if you do not have pleasure in life, then you have major depression. The second category or classification or loading of symptoms is for a period of 2 weeks, if you have sadness, loss of interest, loss of energy, decreased concentration and attention, loss of pleasure again, and thoughts of suicide. If you have 4 symptoms out of these that last for 2 weeks, then one should consider at least an evaluation for major depression. As I mentioned, that major depression is the most disabling illness declared by World Health Organization, because the very desire to do anything disappears. And on functional imaging, you can see the brain is operating only at 6 watts of energy, while the normal brain operates at 14 watts. So half the energy, less than half the energy, is basically not going into functioning. And as I said, all these mental functions correlate, or basically there's no difference between the brain and the mind. They're interconnected. The most important in women, childbearing women, one has to make sure that that the person is not expecting, and especially in the first trimester, since there are no known studies that indicate that any of the psychiatric medicines are safe. It is highly recommended that the person not get pregnant and be taking the medicine. Like any other illness, it is based on biology, molecular biology, and any systemic illness like heart disease or infection or diabetes can cause depression, and depression increases the risk of a medical illness by 100%. That means that you are twice as likely to have a heart attack or a stroke if you have major depression. Aside from antidepressants, we recommend non-medication treatments, individual psychotherapy, and medications. The outcome of treatment is superior with both together than either alone. So if you came to me and asked me which would be the best antidepressant, it would be, I would be lying to you because it is a trial and error. Usually the first medication trial, if carefully chosen, 6 out of 10 people respond. Out of the remaining 4, 2 out of 4 respond to a second or third medication. And there are 2 out of 4 that are left that may need other treatments like electroconvulsive therapy, deep brain stimulation, and there are about 10 million people in the world who require deep brain stimulation for their depression. So, how do we select an antidepressant? We select an antidepressant by the side effects that you do not want, which is kind of a peculiar way, but if all was equal for all medications, you want to select the one that is the least unpleasant. A variety of disorders respond to antidepressants, unipolar or bipolar depression, depression following head injury, depression in schizoaffective disorder, in which a person's thinking is incongruent to their mood. Like they might be telling you or relating a tragedy, but laughing at the same time. Anxiety disorders respond to a variety of SSRIs, that is the selective serotonin reuptake inhibitors. So it takes a while for the medication to work on the neurocircuitry. The brain is an electrochemical organ, and most recently there is a third way of transmission, which is nitric oxide. So electrical currents fly from a node to node, which is the part of the axon or nerve fiber that is not covered by a sheath. And then when it comes to the end of the nerve, then chemistry is involved and there are neurotransmitters. There are 500 neurotransmitters in the brain. So I will select an antidepressant from a class. Now most people pick a medicine from any of the SSRIs like Celexa, Lexapro, Zoloft, or Prozac. Any of these are considered fairly safe. Now, if somebody doesn't want weight gain, then one would select something that does not cause weight gain, like Prozac or Zoloft. So the selection of the antidepressant is very much dependent on what the patient does not want as far as side effects, because they are all equally effective. However, only a few of them will match your chemistry. So initial trial and error, there are a few important points. You have to take a high enough dose, you have to take it long enough, and you have to monitor the symptoms to see if there's an improvement. So 2 months is usually adequate to finish an antidepressant trial. So these are the classes of antidepressants. The older ones were the tricyclics, and it used to be hard to tolerate, like Elavil, Tofranil, their breakdown products, nortriptyline, discipramine, meprotilene, Sermontil. So these were hard to tolerate because they had very strong drying effect, like dry mouth, constipation, urinary retention. So they were very hard to tolerate. As compared to now, SSRIs are very easily tolerable and the side effects are minimal. Monoamine oxidase inhibitors, this is a class of antidepressants which is highly effective. And this works in preventing the neurotransmitters from being broken down into amino acids. So the main neurotransmitters that are involved in depression are norepinephrine, serotonin, dopamine, GABA, which is a relaxing neurotransmitter, glutamate, which is involved in learning, but also plays a role in depression. And as I said, there are 500 transmitters for various functions. The brain has 100 billion neurons and 100 trillion connections. So the way the brain stores information is by manufacture of protein molecules and by increasing the number of networks. If you look at a neuron, I'll show you one. It can have up to 1,000 connections. So the more efficient a neuron, the more number of networks or fibers coming out of it. And then you have the serotonin, norepinephrine, reuptake inhibitors. So all of them do one thing in common, is raise the amount of neurotransmitter for communication in between where the electrical impulse ends, that is the presynaptic terminal, and where the neurotransmitter is targeted, that is the postsynaptic terminal. That's how the brain communicates. It jumps by electricity and then it slows down to chemical transmission. There is, aside from involuntary activities controlled by the brain, nothing happens in the body without a transmitter moving across the synapse. Among the novel antidepressants is Remeron. The serotonin, norepinephrine reuptake inhibitors are Effexor, Pristique, and Cymbalta. You know, there's always a joke about doctors writing. And these doctors have written things on their placards that no one understands. So one of the problems with the older medications was that it would dry the mouth, cause constipation, cause double vision, drops in blood pressure, and would be very easily lethal in a small amount of dose, like a week of medicine could be lethal, but you can take a month of Prozac and it won't kill you. So that is the advantage of the newer medications. Another problem with these was that it could prolong the relaxation of the heart, which means that the heart is at risk for irregular heart rhythm.
Could I ask a question?
Sure.
Earlier you said something about therapy, the usefulness sometimes of therapy for major depression. I can sort of intuitively understand that if I take a drug, that is some medicine, and it's a chemical, it might help the chemistry in my brain. That intuitively makes sense to me.
Absolutely.
I don't understand how therapy
helps.
Can help
Okay.
the chemistry of my brain.
Okay. So studies show that if you go to church every Sunday, your caudate nucleus, which is a major relay center in the brain, grows in size. And with the improvement in the size of the caudate nucleus, it basically has an antidepressant effect. You take example of, so therapy, during the day you have about 50,000 to 75,000 unconscious thoughts. And most people I see, if I ask them why they are feeling sad, they will not be able to tell me. Yes, they might point to a red herring like recent loss, but that might not be it. So therapy helps you analyze where the emotions are coming from and where they are rooted. And once you recognize it, then it is like a leap forward. And so that factor that was causing depression unbeknownst to you, once it has run through a cathartic, and there are different kinds of therapy. There is cognitive behavioral therapy, where the psychologist or therapist will brainwash you that you're sad because you're thinking negatively. So that is cognitive behavioral therapy. And then you have group therapy, in which, again, if you have a very negative perception of life, there are usually 9 to 10 people who are in therapy to disagree with you and give you a different perspective. So the two in combination work well. And also it helps the antidepressant be picked up when your emotional centers are working, like the limbic system. So you must have heard about some of these older medications that used to cause sedation, weight gain, dry eyes, I mentioned that, memory deficits, and sometimes delirium. Delirium is an acute change in memory, where you become somnolent or lose consciousness. And some of the highest number of deaths occur because of delirium, as the person or patient in the hospital will not be able to tell you what is wrong. The symptoms a patient complains of guides the doctor to where to look. I'll mention nortriptyline because before the SSRIs, it was the most commonly used antidepressant, and I used it a lot in Philadelphia. There were about 25 Holocaust victims which were on atomic mattresses. They hadn't walked for years. So then we started treating them with nortriptyline. Their bones were so fragile that when they started walking, they began to have hip fractures. So in depression, you can have severe degradation of your physical body too.
Excuse me, so a question?
Yes, sir.
In one of the earlier slides, you listed several disorders.
Oh, yes, yes.
And I kind of was interested in knowing about the IED, and it's not mentioned here. So would you, is it because you will consider that as part of depression, or what's the...
Which one?
Intermittent explosive disorder, I don't see it here.
Ah, no, that comes under mood stabilizers. I think you will see it later.
Okay, thanks.
So monoamine oxidase inhibitors are interesting because they were first found in a tuberculosis sanitarium they found that an antidepressant or an anti-tuberculous drug called iproniacid started improving the mood of all the people in the sanitarium. But at that time, the treatment for tuberculosis was that you have to be in bed, no moving, minimize oxygen demand, and a lot of these patients would get very happy and then keel over and die, much like the Holocaust victims, who when they got happier, broke their hips. So iproniacid was the first discovery of an antidepressant. This was back in the 1950s. There are things that you cannot eat because monoamine oxidase inhibitors prevent the breakdown of serotonin, norepinephrine, and dopamine. And they do have, unfortunately, other side effects. But for a while, between the discovery of SSRIs and the toxic TCAs, the MAO inhibitors in the 80s offered a very decent alternative for treatment of depression. You have to be careful that there is usually a nasty reaction between a MAO inhibitor and an SSRI. So this is a graphical, you can see so that's the presynaptic terminal I mentioned. Mitochondria, that is like a factory, a cellular factory that produces protein, synthesizes amino acids into peptides, and this is then stored into a vesicle, and then when the electrical impulse comes, there's a small action potential where potassium leaves the cell and sodium comes in, creating a gradient which opens the neurotransmitter to go towards 5-HT receptor. And the MAO, so what the antidepressants do is they prevent the serotonin, which is 5-HT, from being taken up and destroyed by this particular enzyme called catechol O methyltransferase. And here's MAO inhibitors acting on your behalf to conserve your serotonin or epinephrine. And then there are many kinds of 5-HT receptors or serotonin receptors. Some of them, and this goes into detailed psychopharmacology because this is a dynamic system. What the body is going to try and do is it's going to cancel the effect of the increased neurotransmitter by creating more autoreceptors to destroy this. So it's a dynamic system and keeps fluctuating. And serotonin or serotonergic medications help with anxiety too, like panic attacks. Many of them have been approved for generalized anxiety and panic disorders, like Lexapro, citalopram, Zoloft, Paxil, and Prozac. Many of these now have multiple indications so that we can avoid using anything addictive like the benzodiazepines, which of course have a role still. Sexual dysfunction in 30 plus, but not all SSRIs necessarily produce sexual dysfunction in one person. One might produce a problem, and the other problem sometimes can be restlessness, nervousness, but that usually is a matter of dose adjustment. Very little risk of
Yes, I am on sertraline, and I went to the dentist, and I found out that I grind my teeth, and he said that that's a side effect of the sertraline, and my doctor didn't tell me that, and I've not read that anywhere on information about sertraline. So I'm wondering how common that is, and if there are other other psychotropic medications that also have that as a side effect, because I'm on other medicines as well.
Many of them do cause dry mouth.
Not dry mouth, grinding teeth.
Dry?
Grinding teeth.
Oh, grinding teeth. Yes, yes. That is common with some of these antidepressants. Because one of the side effects is you might see muscle cramps. Yes. I've heard patients say that. Are you dreaming at that time? Or
I didn't even know I was doing it, but
Okay.
I'd worn off the porcelain of my crown.
Oh, yes. So any of them can create involuntary activity. It's more common with stimulant drugs like Wellbutrin, but Zoloft is also activating. It conserves dopamine, conserves norepinephrine, and conserves serotonin. So it's a very broad spectrum medicine. So it can activate muscles. Norepinephrine will cause muscle cramps or muscle. So it is possible and not common. But grinding more with amphetamines and Wellbutrin and Cymbalta, Fetsina.
I take Cymbalta. So it might be the Cymbalta as opposed to the sertraline?
Correct. Because Cymbalta causes more dry mouth than Zoloft.
The dry mouth isn't a problem. I don't.
Right. Grinding. I don't know why my mind is stuck on grinding. Yes, grinding. But that's more common with stimulant drugs. And I think Zoloft, that is kind of if it is Zoloft, that dentist might be right. But I've heard it more with Cymbalta, because Cymbalta has more norepinephrine activity than Zoloft.
Okay, so if I'm taking both of them, then I'm getting a double dose of grinding.
Yes. That is a pretty potent combination that you are taking.
Okay.
I was surprised to hear that at the beginning that within 2 weeks of major depression it manifests itself. I thought that in some cases it might be a lot longer than that. For
Yes.
other reasons.
Yes. I think the problem is people tolerate depression for decades.
Right.
So, but the diagnosis itself can be made at 2 weeks.
Really.
Yeah. By the severity of symptoms and by the persistence. It's like if I had major depression, I would probably not go to work. I would probably wait it out. But then most people find that it goes on for years.
Right.
And because it is an inactive, stagnant state of mind, if you have the resources or somebody is supporting you, you might just fall and stay in that for decades. So the number of years lost is huge.
That is very true. I lost many years to my major depressive disorder. It robs you of your life.
Yes.
My combination of drug that works now is Zoloft and Wellbutrin. I've been diagnosed with panic disorder, major depressive disorder, PTSD, and I've been through a few of the drugs, and this is the only combination that has worked for me.
Yeah. because your chemistry is very unique. And every experience or every human interaction is like a chemical reaction that changes your chemistry forever. So sometimes you come across the oddest combination of medications that work.
I don't have any side effects from either one of them that I can put my finger on, which is a good thing.
That is good.
Some of the other ones were, I couldn't function.
Yeah.
And, you know, my major depressive disorder, you know, led me to suicidal thoughts.
Yes.
So,
Yes, they are not easy to take. They've
saved my life, so I will take my medication every day.
good. I'm glad you're feeling better.
Yes, I have a question about oxygen, Lamictal.
Oh, yes,
Yeah,
yes.
I'm actually going to move to Chicago next month, and I'm worried about the seasonal affective disorder.
Yes.
It's very, very bad whenever I go there during the winter. I was wondering if Lamictal can.
Lamictal doesn't work for seasonal affective. Either Wellbutrin or Cymbalta. Wellbutrin has been approved for seasonal affective disorder, and also Cymbalta helps.
I'm taking Wellbutrin.
Okay.
Thanks.
So you may sometimes adjust the dose. What about, you know, you can, have you tried light therapy?
That doesn't help either.
It doesn't?
Yeah, it's the cloudiness and the darkness,
Yes.
the gloominess.
Yes.
So I'm wondering if.
You might want to watch Western movies that were shot in the desert, like Lawrence of Arabia.
Yeah.
Desert movies, yeah.
Or attend the groups, DBSA.
So is this a seasonal job?
No, I have to move because I can't afford it.
Oh, you have to.
I have to move because I can't afford it.
Yes. Yes, that's terrible. I mean that, and it seems to get, I mean, in the county, one of the biggest stressors of patients is housing.
Artificial light.
Artificial light, yes, 10,000 lux.
10,000.
It does work. When I first moved to San Francisco, I was depressed by the perennial rain, and so I got a light. And actually I found that it worked as a stimulant, that I couldn't then sleep at night because it stimulated me so much. But it certainly took care of the San Francisco weather.
I have a friend who may give me one of those lamps for
Yes.
seasonal affective disorder, and he doesn't think he can use it because he's on Narvo, and it says that you're not supposed to be artificial light, like you're not supposed to avoid artificial light, so he doesn't think he can use it. I'm on Haldol, and I'm wondering if there would be any issue of me using the light with
No.
Haldol.
No.
No? Okay, thank you.
So, paroxetine is one of the antidepressants. It is as anti-anxiety effect too. It does cause some sedation, and it is also an anticoagulant. And it does protect the heart from excessive variation in heart rate. So it's a slightly different drug. Most people don't like it because of weight gain. Zoloft, it doesn't have many drug interactions. That is a big advantage. It has a short half-life of 7 days. It's less sedating when compared to Paxil, and maximum absorption requires a full stomach. So it's best taken an hour after breakfast. GI side effects are usually nausea, loose stools. Prozac, as you know, was the first SSRI, and Prozac started the search for serotonin in 2022. 7 mad astronauts are going to rendezvous with an asteroid to see if serotonin came from a different galaxy. And the chances of any 7 of them returning to Earth is 10%. But such is their quest. One of them actually does take Prozac. And he made it his life's mission to find out where serotonin came from. Another thing about serotonin is that today you can do CSF analysis and measure the breakdown product of serotonin and predict suicide. It is a breakdown product 5-hydroxyindolastic acid, which if it is low and you have all the major depressive symptoms, the risk of suicide is very high, especially completed suicide. So there are better and better biomarkers to predict people's behavior, but the mind remains as complex as the universe. It is still just scratching the surface. Celexa was used in Europe for obsessive compulsive disorder for almost 20 years before it was introduced in the United States. It was initially given as high as 120 milligram, and then it had to be reduced because it does cause QT interval prolongation. Again, the risk of cardiac arrhythmias. So the dose is reduced to 40 milligrams. Lexapro is an optical isomer. It's a mirror image of citalopram. Michelangelo used to write in mirror image, and you had to have a mirror to read his writing. Citalopram and Lexapro are not the same drug, but they are mirror images of each other. Lexapro is the second fastest acting antidepressant. Usually takes about 2 weeks to know if it is going to work. Effexor is the other. Street drugs are the fastest.
Not the best.
Luvox is another SSRI that was introduced for obsessive compulsive disorder. There are GI distress, headaches, sedation, weakness. I treated an attorney in Crossville, Tennessee, who had built 6 houses. 5 of them were full of paper and stuff. So every time his house became filled up, these were not small houses. He owned all the houses in the cul-de-sac, but he would refuse to take Luvox, which essentially took care of his hoarding habit and his gambling. But he kept on building houses until I left Knoxville. He had built 6 by then. So, obsessive compulsive disorder can be a very, very disabling and a very focused, highly useless activity. Then you have Cymbalta, you have, these are considered the 2 main neurotransmitters for depression and anxiety. So Cymbalta, Effexor, Remeron in small doses. This is a good medicine, except that 4 out of 10 people, no, 4 out of 100 people have elevated blood pressure. It's an antidepressant which I always tell patients not to discontinue suddenly, because you'll feel rather strange. You'll feel as if the wind is blowing in your ear, the crickets are singing, and every so often you'll get a static electricity shock. But most dangerous, because it comes out of your system so fast, that there's a high risk of suicide. And that applies to all antidepressants. Rapid discontinuation can cause the person to kill themselves, and it happens very quickly. This is the next generation of Effexor called Prestige. It's been around for 6 years, and this is also a very fast-acting antidepressant, and there's also an increase in blood pressure. There's always a perennial battle with insurance companies, but those of you who make less than $35,000 a year can get free medicines from the company. Cymbalta was also approved for fibromyalgia. The way it works is by top-down suppression of pain. Emotional pain makes physical pain worse, and physical pain makes emotional pain worse. That is why some individuals will cut themselves to feel better, because the physical pain alleviates the emotional pain. This is a novel antidepressant in low doses. It is used as a sleeping agent and as an anti-anxiety agent. It does, however, cause weight gain. Wellbutrin is like an amphetamine-like drug, but it is not addictive. It's also used in ADHD. It is also approved for seasonal affective disorder. It has other indications like quitting smoking, improving sexual desire, things like that. I'm going to skip. Obesity doesn't run in the family. The main problem is nobody runs in the family. And many of these antidepressants or antipsychotic medicines have this problem, weight gain. So I have 10 minutes. I will go through these classes. Lithium is the drug of first choice in bipolar 1 disorder, and bipolar 1 with major depression, in bipolar 1 with mixed mood, and bipolar 1 with mania. It is by far the best psychotropic and the only psychotropic that is known to prevent suicide. And as you know, it is a salt in the same column as sodium, cesium. If it was any lighter, it would spontaneously combust. However, what it does is that it stabilizes the cell membrane. It prevents it from becoming irritable or excessively responsive to changes in action potential or minor changes, even like a change in cell by 6 to 8 millivolts. The lithium is able to stabilize the membrane. And by extension, as I said, from molecule to behavior, it stabilizes behavior like racing thoughts, euphoria, not sleeping for several nights, making grandiose plans, becoming hyper-religious, becoming promiscuous, and one patient described himself as being motor mouth or excessive speech. I didn't say that, he did. As you know, it was discovered in Australia and is perhaps the best medicine even for major depression when major depression does not respond to standard antidepressants. It is a bit dangerous to use it. I discourage it in people who have decreased kidney function. The thyroid needs to be monitored. Oh, side effects are, there is a tremor, there's increased urination, and if you don't watch it, then it does tend to dry the kidney. And hair loss, acne, I have not come across hair loss that much. It does reduce the seizure threshold, it does slow down the mind, but that's the purpose. There is an intention tremor that can be treated with beta blockers. Lithium toxicity can occur in older people, even at normal levels, but it can be life-threatening because, again, the person becomes delirious and they're not able to tell the doctor what is going on. Next is anticonvulsants. These are a class of mood stabilizers that tend to calm the brain. Valproic acid, Depakote is the most common. So people who change in mood from morning to afternoon, the next day, sooner or later, people operating next to somebody whose moods are very turbulent, then the need to stabilize their mood. Valproic acid is neuroprotective, but you have to watch the liver in this case, and you have to watch the bone marrow.
What did you say you have to watch besides bone marrow?
Bone marrow and the liver. And it shouldn't be taken during the first trimester because of neurological abnormalities in the baby. Carbamazepine is used in complex partial seizures, which sometimes overlap with psychiatric illness, but it's a good mood stabilizer and has mild antidepressant effect. So I'm almost out of time. I'll leave some time for questions.
Can you just go back one screen and back to difficult?
Difficult?
Yeah. No, I mean, further up.
So it's as effective as lithium
And what are the side effects?
of Depakote. Usually you have to watch the liver and watch the platelets. And it is sedating. And the pill size is huge. So a lot of people complain of swallowing. But you know, the thing is that if it works for you, you will tolerate the side effects. So I can't say that lithium is better than Depakote or Depakote is better.
Yes, about the lamotrigine, how risky is that with Stephen Johnson's?
Okay, so neurologists increase lamictal very quickly. The major reason for the rash, which cannot be ignored. So it first appears as a sun rash. If you ignore that, you're supposed to stop the medicine and talk to the doctor. The next, what happens to the rash is it becomes like smallpox, not smallpox, chickenpox. You have vesicles, you have blisters, and you have to stop it.
You can start it again.
No, because of delayed hypersensitivity. Because the second time the reaction is worse because you have some antibodies to it. So then you're going to have even a nastier reaction. And Stevens-Johnson is the third kind of. The problem with Stevens-Johnson is that it causes massive amount of inflammation of the skin and then blistering. So literally the skin feels soft.
How prevalent is that?
Very rare, but usually associated with rapid increase. So I usually start with 25 milligram, wait a week, 50 milligram, wait another week, so I go only 25 milligram. But I've seen neurologists go from 100 to 200 to 300, which I think will be very anxiety provoking for me. Because the last thing I want is my patient to have Stevens-Johnson.
Can you just say a little bit about Risperdal and
Yes.
Invega?
So Risperdal was one of the first medication that worked on negative symptoms. Negative symptoms in schizophrenia are like apathy, not wanting to do anything, almost like depression. Even if all the hallucinations, the thought influence goes away, the person does not functionally improve, like in taking care of themselves, or going to school, or working, or being independent. So Risperdal helps with those symptoms of initiative motivation, which the older antipsychotics do. The advantage of Invega is that it does not have as much weight.
As much what?
It does not cause weight gain as much. Please.
So how often you run into patients that know they have problem but refuse to take medicine? Kind of not over the threshold of taking medicine,
Yes.
for whatever reason.
That, you know, in psychiatry, we treat the person, and other branches, they treat the illness. So one develops skills to involve the patient in the decision process. That's why consent is such a big thing in psychiatry. Information is such a big thing. You reduce the divide between the doctor and patient by telling them as much, yet not frightening them. I don't know how you cannot frighten someone when you show them the informed consent. So many of these side effects are actually very low frequency. So compared to placebo, that's how you see which side effect is one to worry about. So patients deny psychiatric illness. I think that, of course, there's denial as a defense in many other illnesses like myocardial infarction, but denial in psychiatry is no one wants to admit that they need a medication to function. And there's also, of course, things are getting better. The feedback from society or family is frequently negative. I mean, they might sympathize for a month, but after a month or two, they become rather irritable with you. So what you don't see, I think, and a lot of times people cannot imagine walking in mentally ill patient's shoes. So that also discourages patients from taking the medicine, though that is the main way. The more compliant you are, the better your system responds to the medicine and changes. As I said, the brain is a dynamic system. it changes with the help of the medicine. Yes?
So, I'm currently taking Zyprexa, and I was wondering if I've been too sedated. I was wondering if I'm being less sedated.
Yes, yes. Both have the problem of increasing appetite.
Oh,
The advantage with the Vilify is that it improves initiative and motivation. So it acts on the prefrontal cortex. So you're more likely to get an antidepressant effect with the Vilify. You wanted to ask a question?
Well, I was going to ask you to talk about magnetic stimulation because
Yes.
you didn't mention that.
Yes. Transcranial magnetic stimulation. We are going into quantum physics now.